We are also recording this session, so please make note of that. We will be asking folks to place their audio connections on mute since we have so many people online, and I will be monitoring the audio as well, making sure that we do have a conducive environment. If you happen to lose connection or need the login telephone number, you can check your email or the event information tab above. If you have questions, we're asking folks to use the Q&A box so we can easily track those questions and answers for the presenter. You may use the chat box, but sometimes it's harder to track questions. Webinar documents will be emailed out to participants in terms of the PowerPoint slides and decks. This is really important as well. If you did not register for the event and you might be sharing a connection, please email the NCTTA Center and let us know your name and organization and certify that you attended the webinar. That's the only way that we know to send out a certificate if you did not register. And you will be forwarded a workshop evaluation survey immediately after the webinar. You will receive a link for the recording of the webinar and a certificate next week of attendance. And as always, if you have questions or run into technical issues, feel free to send me an email at the NCTTA website. Rhonda, are you online with us?
I am here. I just saw a note pop up, Jamie, that someone was having trouble hearing.
Okay. You may want to, if you're having trouble hearing, I will respond to this chat message in a moment. And okay. I may want to hang up and call back in. That frequently solves the issue.
Okay, perfect.
Okay, great. Rhonda, you have presentation capacity, so I'll give it to you.
All right, perfect. Thanks, Jamie. Good afternoon, everybody. We have a large group of folks on the phone and in the session this afternoon. So it won't be as interactive as it could be, but I hope that if you all have questions or have comments that you want to add to the content, you'll use that chat box on the right as Jamie indicated. Jamie will be watching that throughout the presentation, so if you have questions, please post those questions, and I will do my absolute best to get them answered. We're here this afternoon. We're going to talk about aligning partners to reduce prescription drug abuse. And this is similar to the content that we presented last month when we were face-to-face in North Carolina. I guess it was January. So hopefully we have some of the folks who are in the classroom with us online and then some of their community members. I know that this will be new information for many of the folks on the phone as well. So again, please don't hesitate to ask questions. My email address is included in the lower right-hand corner of your screen there, rhondaramseymolina@gmail.com. As a participant in the webinar, you have access to me, and you are more than welcome to shoot me an email with any questions you might have. If you walk away from the webinar today and want to think about how you might use what you learned, please don't hesitate to shoot me an email. We can schedule a call, get on the phone, and talk. We'll talk a little bit more about that at the end of the session today. This is a picture of me for those of you who I have not met. I'm guessing if there's 80 people from the state of North Carolina on this webinar, there are folks here that I have met. So hello again to those of you who are old friends, and hello to those of you who I have not met yet. I have been working in the field of coalitions and community change management and collective impact for almost 30 years. I never thought I'd be old enough to say that. But I started my career fresh out of college, and I was a VISTA volunteer, Volunteers in Service to America. And I was doing some work in the urban core of Cincinnati. And I had a group of late elementary school girls. We were doing drug prevention, and the one little girl said, when I grow up, I'm not going to do drugs. And I said, that's great. She said, let me tell you what I am going to do. She said, I'm going to have a baby, and then I'm going to get married, and then my boyfriend is going to sell drugs so we can be rich. And I said, well, you know, it's against the law to sell drugs. What happens to people who sell drugs? And she said, they go to jail for 30 or 90 days, and then they get out and you have a party. And I realized that the messages that she was getting in her community was very different than the messages she was getting in the program that I was providing. So I asked her, what do you want to be when you grow up? And she said, when I grow up, I want to help people with sick hearts. She said that the single most consistent male influence in her life, her grandfather, had recently died of heart disease, and she wanted to help people with sick hearts. I knew in that session that we had a long way to go to help this young girl realize her dream in a community where little girls aspired to marry drug dealers so they could be rich and have all of the things that the material things that they thought that they wanted. But she had life's dream. I didn't last much longer in direct service. I left program provision and I moved into this space of community building and coalition building and collective work so that I could steward the process or be a catalyst for change in how people and systems work together so that we can better achieve our outcomes. And that really is the premise for this work that we'll be doing this afternoon. It really is about how do we align our people, how do we align our resources, how do we align our strategies and our systems so that we can work together better and more efficiently to produce bigger, broader outcomes for people in our communities. So thank you for the opportunity to be here this afternoon, and I look forward to the session. Now, the session is lined out into 3 parts because goodness knows a 3-hour webinar has the potential to be a bit painful, right? And I recognize that. So I broke the session down into 3 45-minute sessions. So part 1 of what we'll do today is we'll talk about what is this thing called collective impact. What does that mean? And we'll talk about the theory and the framework. Then we'll take about a 15-minute break. We'll come back in part 2 and we'll talk about what does collective impact mean in your community working on the issues that you're working on. So we'll take it from theory and make it real in your community. Take another 15-minute break. And we'll come back for part 3 because even though we know what it is and we know what it means in our community, that doesn't necessarily mean we know how to do it. So part 3 is really talking about what are the tools and the techniques that we can use not to start over, not to do something new, but to take what we're already doing and elevate it, make it more of a collective impact effort instead of our own individual achievement effort. So that's part 3. When we come back, we'll be talking about how do we do it. So, and then we'll finish up somewhere between 3:45 and 4 o'clock this afternoon, depending upon how our breaks go and our content, so on and so forth. So that's our agenda for today. And again, broken into 3 different parts with some breaks in between so that you can give your eyes and your butts a rest and get up and move around. All right, so to get your minds ready to delve into this content and this information, I want you to take a second and think about what is your vision of success. And I can't see you, so I don't know if you're doing this, but I'm going to challenge you to get out a piece of paper and a pen and actually write down what is your vision of success. Why are you doing what you're doing? What are you trying to achieve? Now, my vision of success for this webinar is that participants who are sitting in on the webinar are able to apply the principles of collective impact to their current work. That's success for me. Your success might be every house in my community secures their medication, or it might be reduce the number of opiate deaths in my county. Whatever it might be, but I'm going to be quiet for just about a minute and let you really think about and get in front and center in your brain, what is your vision of success? So ready, 1, 2, 3, go. All right, so now that you have your mind centered on what is your vision of success, and it doesn't have to be perfect, I just really want to make sure that you have your mind centered on what you're trying to achieve. Then I want you to take a second and I want you to think about, why is this training important to you? What are you hoping to get? What do you want to have at 4 o'clock that you don't have now? And set those expectations again for yourself of what do you want to get out of our time together. If anybody is interested in sharing why this training is important to you, feel free, please, to type it into the chat box, because it's helpful to me to know what your expectations are and what you want to get out of the training. So at least set some expectations for yourself, and if you'd like to share what you're looking for, type it into the chat box, and we'll take just a quick minute to do that. All right, so now you have front and center what your vision of success is, and you have an idea of what you're hoping to get out of this training. I can present the information, but it really does have to be a team effort to make sure that I'm presenting the information that you want to hear. So reach out via the question and answer box and ask those questions. Here's where I'm going to challenge you to do a little bit of work at your own individual desk again. The essence and the foundation of collective impact is how we work together in communities. I like to see it as everybody is already doing good work. I call them silos of excellence, right? Everybody is doing excellent work independently in their agencies, in their programs, in their schools, churches, so on and so forth. But if we're going to elevate that work to produce broader outcomes and bigger outcomes, we have to figure out how to work together better and more efficiently. So we're going to do a little bit of an exercise and talk about mapping my connections. I asked you to identify what success is or what your goal is when we first started. What I'd like you to do is get out a piece of 8.5 by 11 piece of paper, and in the middle of the paper, put a circle and write your goals. Now, your goal could be broad, like reduce prescription drug abuse, or it could be far more narrow, like every house in the county secures their medication. But right in the middle of that circle, what your goal is. Now what I'd like you to do is begin to think about who are the people that you're working with right now. Who are the systems and the people and programs that you're working with, and build circles around your original circles like you see in the PowerPoint. So if my goal was to reduce prescription drug abuse, my potential partners would be the Drug-Free Coalition, school-based prevention programs, doctors and dentists, the health department, so on and so forth. So my challenge to you here is not hypothetically who should your partners be, because we'll get to that later. What I want you to do right now is build circles or build bubbles for the partners that you currently have. Who are you currently working with? And I'll give you just a minute to do that. All right, now once you've talked a little bit about who are your partners and who are you working with, then I want you to think about what kind of relationship do you have with those folks. And you'll notice here, if you follow the little arrow that I'm using on the screen, between the United Way and reducing prescription drug abuse, there's an arrow that points from United Way to the goal. that indicates a one-way relationship where the United Way is maybe contributing money or contributing other types of resources to the prescription drug abuse issue and to your work, but it's not necessarily back and forth interaction or back and forth work. It's just that the United Way is contributing to the work that you're doing. If you move over one box with the Drug-Free Coalition, it's more of a partnership. You're actively working together to reduce prescription drug abuse. So you would draw a two-way arrow for those partners where you're working together actively. If you go over one more with the school-based prevention programs, you can see that it's a one-way arrow going the opposite direction. So you're giving a lot to that relationship. Maybe you're providing the programs in the school, but there's not ongoing communication and collective work. It's just your provision of resources or support to the work that they are doing. Now, it's really important here to, this again is setting the mindset for the afternoon. We're going to be together for a long time this afternoon. So taking the time to get ready to receive this information and be able to apply it to the work that you're doing. So building the bubbles. Now I want you to take a second and determine for each of those bubbles that you have drawn, how is that relationship going? Are they giving to you? Are you giving to them? Or is it a two-way street? And again, I'll give you a minute to do that. No, I got it. All right. Now, when we did this exercise in the classroom there in North Carolina, we had one participant who decided that they're sitting at the same table, but they're not really working together. So she decided that she was not going to draw an arrow, but she was going to draw a bit of a dotted line, because that indicated that, yes, we're sitting together, but we're not necessarily working together. And I thought that was a very interesting perspective. And when I, applied that to my work over the years, I thought you're absolutely right. There's a lot of times where we're just sitting together at the same table. It doesn't mean that we're actually working together. So if you had that kind of circumstance, you can just draw a straight line between the two without any arrows, or a dotted line that says, okay, we're in the same space, but we're not really working together. But being able to identify how those relationships are aligned right now before we start is really important as we go through the content for the rest of the afternoon. All right. So now hold on to that, what is your connection, and that whole mapping of your connections activity. Set it aside, but keep it handy, because you'll need it to refer to as we go throughout the rest of the material. So here's where I'm going to start to challenge us a little bit to start to think differently. How can we make that connections map a little stronger, a little more productive? Well, we got to begin to think outside the box. A lot of us, here's where we are. We're very busy. We have work plans that we have to implement. We have goals that we have to meet. We have meetings that we have to go to. We have dinners we have to cook. All of those sorts of things, we're very, very busy, and I recognize that. But the result of that is sometimes we get stuck in the box, and we even have some new and creative ideas, but a lot of times those creative ideas are in the box. So the challenge of where are we going is we got to do some transformational thinking. We got to get innovative, we got to get creative, and create some new pathways to achieve the outcomes. So we got to get outside the box. We got to think outside the box. And one of the, I think, the most profound things about collective impact, the collective impact framework, is that it doesn't challenge you to throw away the box. It doesn't challenge you to move that far away from the box. It just challenges you to get outside of the box and expand your thinking and view bigger, broader opportunities. So this collective impact isn't about a new program. It's not about a new project. It's not about doing something totally different than what we've done before. It's just thinking about the box in new and innovative ways outside of the box. Also important is that we're generating that innovative thinking, that creative thinking, that outside the box thinking with our partners. It's not enough for just me to think outside the box if I can't align my partners in innovative ways to achieve impact together. So it's thinking outside the box, aligning our partners, and then moving our partners outside the box as well. If we're truly going to have broader impact and use the information that we're talking about today, it really is a challenge for us to come from inside the box to outside the box and then to bring our partners along with us. As I said, collective impact is not a new program or a new project. It really is the evolution of the work that we are doing right now. And the joke that I like to tell, but it's not really a joke, is that we need to learn from infant car seat safety. If you look at one of the very early versions of a car seat on the far left-hand side of your screen, it looks like the poor little guy is sitting in a milk crate, right, tied to the front seat. But it really is an early version of a car seat because there were parents and communities that said, we have too many small children who are being injured in car crashes in our community. We need to do something about it. So we started inventing car seat safety for children. Then if you move to the second from the left, and we have the beautiful lime green and orange flowered car seat. That's my first car seat that I remember with the little metal rod on the back that moved from the car to the kitchen table and anywhere else that we wanted to go with a very flimsy little plastic strap. I don't even think those had buckles. They were just little strappy things that held the baby into place. It was better than the first car seat, but we weren't quite there yet. So as we studied crashes and we studied injuries in children, we realized we need to continue to evolve and develop more efficient safety restraints for children in cars. So we move over to the third car seat, right around the ages of 1980s, 85 or so, and that was a more sophisticated car seat where we had infants in little buckets that buckled into the back seat, snapped into the back seat, but you were able to pull the baby out, carry the baby around on your arm. Having 3 small children, very close in age, those things were very, very heavy, right? But they did the job. They kept children safer than the previous car seat. But we still had children who were getting injured and dying in car crashes. So as we move over to the far right, we said we got to keep going. We got to get more sophisticated. On the far right-hand side of your screen, you see a car seat that is a very sophisticated car seat, 5-point restraint, head supports for infants that are riding in cars today. I shared the story of my niece whose 3-month-old baby was in the back seat, and her car was T-boned on the infant side of the seat.
I don't know.
Interesting.
Somebody's not on mute.
Probably us.
All right, perfect, thank you. So if we're on the far right side of the screen, I was sharing the story of my niece whose 3-month-old infant was in the back seat. Their car was T-boned at a high rate of speed on the infant side of the car. And her son came out of that accident with not a single injury in a very sophisticated car seat. So the point is we never lost sight of our goal as we developed car seat over decades of work. We started with one that looked like a milk crate. Kids were still chipping their tooth on the corner. We elevated throughout the course of evolution based on what we were learning. We didn't say, oh, that car seat didn't work. Let's try something totally different. Let's try something totally new. We said, based on what we learned from the first car seat, what do we need to do differently in the second car seat? Based on what we learned, what do we need to do next? Based on what we learned, what do we need to do next? And collective impact is challenging communities to do exactly the same thing. You've been doing this work in your neighborhoods, on your streets for decades. We've been trying to prevent drug abuse. We've been trying to intervene with people who are using. We've been trying to provide science-based treatment and recovery support. We're not changing the goal. We're just learning from what we've done, what worked and what didn't work. And based on that research, based on the practices and communities, based on what we've learned, where do we need to go next? And that's where this collective impact idea comes in our work, because we have to move from silos of excellence into aligning those silos in ways that create collective excellence. So what does that look like in the world of substance abuse? We've evolved as a field as well, all the way back to Nancy Reagan, and it goes back further, but I started with Nancy Reagan in her Just Say No movement. And we realized what worked and what didn't work there, and Just Say No as a standalone was not as effective as we needed to be. So we added in 1983 and thereabouts, we added in the media campaign. Many of us have seen the egg in the frying skillet, this is your brain on drugs, right? And again, we achieved some results, but we weren't quite there yet, so we got to keep moving. We added in DARE, we added in Red Ribbon Week, we went through a series of mock crashes and those sorts of things in communities. Then all the way down in the bottom left-hand corner, we got to NREP, which was the registry for evidence-based programs, and moved then into the coalition movement. Coalitions had a series of successes, but they were floundering and didn't really know where to go. And we came to the Strategic Prevention Framework, which hopefully most of you are familiar with. We'll talk a little bit about it in a minute, but not in depth. But the point of this slide and the previous slide, and where I'm hoping to get your mindset for this afternoon in our work together, is that we're talking about the evolution of our work. We're talking about understanding what we're doing right now and how can we elevate it to do it better. We're not talking about throw away what we're doing and do something different. We're talking about take what we've learned, apply it to where we are, and move in new and innovative directions. The innovative directions that we're going to talk about today primarily are aligning our partnerships. How do we align with other people who are doing good work so that together we can do better work? So in coalitions, where we landed in this development of the substance abuse prevention field, is we found that it was the best practice. We found that communities that had coalitions who were achieving greater reductions in drug abuse than communities that did not have coalitions. So we caught on to something. All right, coalition is working. It's working in communities. So people started putting lots of money into it. And everywhere you went, you got funded to do whether you were funded for a program or a community-based project, you had to build a coalition or participate in a coalition. So lots of funding was made available. There were a couple of challenges. The funding streams were still in silos and they were very issue focused. So we ended up with a coalition for everything. Now we have obesity coalitions, violence prevention coalitions, drug prevention coalitions, and in many communities now, we have drug prevention coalitions, but we also have opiate coalitions and opiate task forces. We have marijuana coalitions. We have alcohol coalitions. So we ended up with a coalition for everything. Another challenge is that coalitions are often not connected across issues. And oftentimes it's due to funding constraints and also a lack of know-how. A lot of communities say, okay, now we have 10 coalitions. And the interesting thing is the same 15 people go to all 10 coalition meetings. And even though I was just at the Violence Coalition and I'm now at the Opiate Coalition with the same 25 people, we don't talk about violence in the Opiate Coalition and we don't talk about opiates in the Violence Coalition. So I was a practitioner for 20 years. I was in your shoes. I was building coalitions in communities. I was trying to implement programs and strategies with partners. I get where you're at. So I have been in your shoes. I was in communities where we had coalitions for everything and they weren't connected. So how do we connect them? How do we connect our efforts? There was a lot of money put in, again, to figure out how do we do that. The Knight Foundation, CSAP, Robert Wood Johnson Foundation, lots of folks put money into this space about how do we build coalitions and also how do we align efforts across issues and communities. And we learned a lot. Coalitions are effective in positively impacting social problems. If we want to reduce violence, if we want to interrupt gang activity, if we want to reduce drug abuse, prescription drug abuse, If we want to build a healthier, fit community to reduce obesity, a coalition is a good way to do it. But too often, there's too much planning, too much talking, and not enough doing. We get all the partners together in a room when we sit and talk about it because we don't really know how to work together. So we do a lot of planning, we do a lot of talking, but not a lot of doing. Outcomes matter, but it continues to be difficult to demonstrate those outcomes. So if we have 8 partners who are engaged in collective work, how do we measure outcomes across systems? Because the school district has one set of outcomes, the health department has one set of outcomes, the hospital has one set of outcomes, and maybe me as the recipient of state funds to reduce prescription drug abuse, I have a whole different set of outcomes. So everybody is working and trying to achieve their own individual outcomes because we don't have collective ownership and a common set of outcomes. So with coalitions, outcomes matter, but it still continues to be difficult to demonstrate how the collective work is achieving those outcomes. Emerging issues can't be ignored as we maintain the status quo. A lot of coalitions or collective groups will get together in a room and know that we're working together to reduce prescription drug abuse, and we're going to come up with strategies to do that, and nothing else matters. For example, a lot of the opiate task forces and prescription drug abuse task forces that have happened around the country, they very quickly realized that they could minimize or at least decrease the number of deaths by equipping their first responders with Narcan. And while that is in a very efficient way to reduce opiate overdoses and deaths, it became very quickly apparent that it was cost prohibitive. We have one overdose that's requiring 8, 10, 12 shots of Narcan, and our first responders are saying, we can't afford this. And at the same time, we weren't doing anything with intervention, we weren't doing anything with prevention, and communities just began to rely on, let's get Narcan. And while Narcan is a very important part of the solution, it alone is not going to solve the opiate problem in our country. So we cannot ignore emerging issues. If we're learning that Narcan is good, but it costs too much, then we have to figure out what's next. Again, we have to evolve. We have to keep talking about it and create space for the emerging issues that are coming out of our work together collectively. Research reveals new and necessary considerations for our work. In this one, again, I don't think I can stress enough how critically important it is to stay on top of research and to stay on top of what's happening in our field. Sometimes we get so laser focused on what we're doing that we forget to pay attention to what else is going on. And my example here is the emerging science and knowledge around the impact of trauma on young people and even adults' decisions to use substances. You know, we may have a 35-year-old person who had never had a substance abuse problem who may have gone through a series of traumatic events, and then that was, one of those was resulting in an injury where they were given a prescription and now using that prescription to manage some of the symptoms of trauma. We know that kids who are struggling with trauma and the impact of complex trauma in their lives may self-medicate with substances, and which leads into a life of substance abuse and even violence and crime. So as we learn about trauma and the impact of trauma on the biology, on the brain of individuals, how can we infuse trauma and work around trauma into our prevention efforts? So it's not that we need to go build a trauma coalition. We need to take the ideas and infuse it into the work that we're doing. Infuse it into our prevention efforts. Another big issue that's happening in our field is equity and health equity and disparities between populations. You know, if we've been functioning as a coalition or as a service provider or even as an agency for decades, and we've been providing prevention programs or even treatment programs, and we've been doing it the same way over and over and over, it's time for us to start infusing some of the research, new and evolving research, into our work. For example, I've worked with many drug-free coalitions over the decades, and they always use the same set of numbers. 32% of our seniors are regular users of alcohol. 27% of our seniors are regular users of marijuana. 14% of our seniors in high school, I'm talking about seniors in high school, 14% of our seniors in high school are regular users of tobacco. If we infuse the emerging knowledge and implications of health equity and disparities, and we've been doing this for a while, it's time to stop talking about the whole population of seniors in high school. Of that 20% of seniors in high school that are regular users of marijuana, how many of them are male? How many of them are female? How many of them are African American? How many of them are Native American? How many of those, that 27%, live in certain zip codes in communities? How many of those live in certain zip codes within our community as we look and we study our populations within our population? So it's very important, this idea and this concept of infusing evolving research into our work as we move to elevate our work to achieve broader outcomes. Now I'm going to take a second and I'm going to give you a chance to go back to mapping your connections. And I want you to think about just those two issues that I put on the table, the idea of trauma and the idea of disparity. And think about your community as you think about your issue, as you think about what you're trying to achieve, what your goal in the center of your map is. I want you to think about who are the people in your community that are working to increase equity, reduce disparities, and who are the people in your community who are working on trauma and trauma-related issues. And I want you to draw a bubble on your Mapping My Connections map for the people who are working in that space, because I want us to explore how can we involve those people, how can we involve those systems and partner with those systems more effectively. So I'll give you just a second to do that. All right, so I'm having a little bit of technical difficulty for just a second. Jamie, can you advance us to the next slide to Strategic Prevention Framework? All right, so we have the Strategic Prevention Framework in front of us, and the Strategic Prevention Framework offers us a pathway for getting to outcomes, right? In coalitions, if we're going to be effective, we have to go through a strategic process to get to outcomes. And for those of you who are familiar and for those of you who are not, the quick 30-second version of what is the Strategic Prevention Framework, it says that we start with the red bubble at the top and we have to do an assessment. It's critically important if we're going to address the issue, we have to address it from knowledge, not from a gut feeling, not from a hunch, not from what we heard in a meeting last week. Our assessment challenges us to collect data, to know and to understand what the issue is, what the data says about the issue in our community. Once we have an understanding from a data perspective, then we have to understand about capacity. What is our capacity as a community to respond to what we uncovered in the assessment? This green bubble here in the Strategic Prevention Framework is a critically important part of collective impact, because it really is about building and expanding our capacity as a community to work together to address the issues that we have identified through the assessment. All right, then we have planning. When we do good planning, do cross-system planning, we can end up with a coordinated strategic plan for our community versus a singular plan for our agency versus a singular plan for our own individual goals. We have a coordinated, comprehensive plan in the community. Then this blue bubble is where I see in many communities rubber meets the road. This is where I see most coalitions and most communities fail, because they have lots of plans, they have lots of data, they've had lots of meetings, but they haven't the ability to actually implement those plans. A lot of times those plans are on the shelf, they look pretty, they're color coordinated, but they're collecting a lot of dust because we don't really know how to implement those plans. And again, that's a lot of the collective impact piece related to capacity and to implementation. And then evaluation. I don't know about you, but I'm really busy, and I tend not to like to get involved and join into things that I don't know whether or not I'm making a difference. So evaluation allows us the opportunity to know whether or not we're making a difference. And the center of the strategic prevention framework is sustainability and cultural competence. We have to be around long enough to know whether or not we're making a difference. So we have to sustain for a very long time. And then we have to be culturally competent. And culturally competent is not always black, white, brown. Cultural competence is related to demographics, but it's also related to geography. It's also related to socioeconomic status. So it's critically important that we understand the diversity that exists in our community, and we're able to respond in a way that makes sense. I remember doing a lot of work in communities in the state of Montana. You know, in Montana, with a lot of ranchers, a lot of people, a lot of rugged people who work on a lot of rugged land. Their philosophy was work hard, play hard. And they worked very hard all week long. But their philosophy was you play hard all week long. There was a lot of drinking that went on in a lot of communities after we got done working hard all week. And we had a lot of parents who indoctrinated their children at the age of 12, 13, 14, 15 years old into that drinking culture. They were proud of teaching their kids to work hard, but they were also very proud of teaching their kids to play hard. So we had to be very careful with the way that we came in doing prevention programs, because we had to be sensitive to what their philosophy and what their culture was. All right. Jamie, can you advance me again to communities are at the crossroads? Okay, perfect. All right, so communities are at a crossroads now at this point. Particularly when we look at something like the opiate epidemic and the number of people in our country who are suffering the consequences of opiate use, serious lifelong consequences as well as even in some cases death. Single programs are not going to get us to the amount of outcome that we need to positively impact the problem. We have to begin to work together in new and different ways. Our leaders are being asked to share accountability, to select and manage cross-system, cross-issue strategies, and then be able to evaluate it. This new way of approaching this community change effort is what we're calling collective impact. Essentially, it requires, and this is really important, an unprecedented, outside of the box commitment to community-wide, multi-sector, multi-issue performance management, and the realities that most community leaders can't fully imagine, let alone manage that level of effort in communities. So we got to move. We got to pick up from where we are and move to where we need to be. All right, next, Jamie. Collective impact is the evolution of our work. It's not starting over or chasing the next grant or the next hot issue. This is not a new project that we're going to implement in our community. The reality is we're not corporate entities who are trying to outdo our competition and increase our market share. We're all serving the same population. We're all working in the same community. So we have to figure out how to do that better and more efficiently, because real social change happens when organizations go outside of their own walls and find creative ways to partner and align efforts across organizations, issues, and systems. We're all working with the same population in the same community. How can we come outside of ourselves and align our efforts across organizations and issues and systems to achieve broader results? Next slide, Jamie. All right, so this is just a funny cartoon that I like to share when we're talking about collective impact. Sure glad the hole isn't at our end of the boat. Glad it's at your end of the boat. Next slide, Jamie. If we're going to move into collective impact, we got to re-envision that. We're moving away from isolated impact where everybody is talking about their own thing, moving in their own direction into the bottom effort, which is collective impact. What is very real here is that we're not just aligning in new ways, we're actually creating something new. So that it's no longer the big fish, the opiate epidemic attacking us, it is we collectively attacking the opiate epidemic. Next slide, Jamie. When we move from isolated impact to collective impact, we're moving away from assuming that success depends on making one program bigger. Collective impact is about cross-sector alignment and learning among many organizations and collective movements. Next slide, Jamie. What we're really talking about in its most simple form, and this is a very important slide, and think about the bubbles in mapping your connections. Take what you're doing and align it with someone else to achieve greater results. So when you think about your mapping your connections map, the question that you should be asking yourself is, who else is doing this work, and how do I figure out how to work with them? Next slide. Collective impact is aligning the gears, putting the gears up against each other and getting them to work together. Next slide. What is collective impact? Let's talk about the framework, the actual theory of the framework. In 2011, FSG, an organization, a national organization, published an article in the Stanford Social Innovation Review. And Mark Kania was the primary author. What this article is, and this is important to understand when we think about collective impact. What this article is FSG, Mark Kania, and his partners went out around the world, and they studied collaborative groups, coalitions, networks, task forces, whatever you call them. They studied them, and they said, what makes a difference? When are these collaborative groups successful, and when do they fail? And what they found in studying, and these collective groups were addressing everything from nationwide hunger and starvation to clean drinking water, to the AIDS epidemic, to vaccinations, to the drug problem. Everything that homelessness, to everything that you can imagine. They studied coalitions across all social issues. And what they coined was, what they found led them to coining this phrase of collective impact. Next slide, Jamie. What is collective impact? Collective impact occurs, and occurs is in red and underlined because it is a happening. It's not a program, it's a happening. Okay. And it occurs when individuals and organizations across issues and systems agree to solve a specific social problem using a common agenda, aligning their resources and efforts, and using common measures of success. This is what John Kania and his team found, that if we're actually going to achieve a collective impact, achieve outcomes together, it happens when organizations agree specifically to work together to solve a problem, they align their efforts and their resources, they agree on an agenda, and they measure their outcomes together. They engage in three very important things: collective seeing, collective learning, and collective doing. Collective seeing is, I'm no longer going to understand the opiate problem from my perspective as a doctor alone. And I'm no longer going to understand the opiate problem as just a police officer or just a parent or just a treatment provider. There has to be some collective seeing and understanding and the ability for people to see the problem from different lenses across the community, not just the way that I see it and how I work towards it, but how do we see it and how do we work towards it. So the collective seeing is the collective understanding of the issue we're trying to address. And then the collective learning. Again, the school district looks at school data, the police department looks at police data, the health department looks at health data, the hospital looks at hospital data. How do we pull the data out of those silos of excellence and share it across those silos so that we can collectively learn and understand what the issue is? We're not just looking at our own data, we're now looking at everybody's data across systems and issues. And then the collective doing is critically important. Collective doing says that we have to strategically align our efforts. When I've gone into communities and I have created a resource wall where we say, okay, what is everybody doing related to the opiate epidemic? It is amazing to me how many times we see the overlapping and the duplication of services and efforts in one space where we have an enormous hole, a Grand Canyon of lack of services in another area. So how do we align our services to make sure that we have comprehensive coverage in our communities, but that we have the right set of strategies addressing the exact right issues to achieve the outcomes that we seek to achieve? That's collective impact, collective seeing, collective learning, and collective doing. Next slide, Jamie, real quick. This is what it used to look like. This is silos. We all know that we have to have successful children. And everybody's throwing darts at the target. And everybody's getting kind of close, but we're not having the success that we want to see because everybody's working in their own way, shooting at the target in their own way. Next slide, Jamie. In many communities, we've moved to collaboration, where we still have single arrows, but at least we have an agreed upon target. We agree that we're all trying to reduce, and this is where we get into meetings where we're sitting alongside of people, but we're not really working together. We're all throwing arrows at the same problem, but we're not really working together. And that oftentimes is what we call collaboration. Next slide, Jamie. Collective impact is a little different and more sophisticated than simple collaboration. You'll see that there's one shot, one dart going into the center of the bullseye. But that one arrow is the culmination of many partners. It's the aligning of the partners before we start throwing things and throwing solutions at the bullseye. We sit down, we align, we figure it out. And so the other example that I use is when in a community, in one community that I'm working in Cincinnati around trauma-related issues, it's an urban school in the urban core. And when we first started with them, they had 624 partners. They had 624 people and systems that wanted to come in and do programs and projects with the kids in this particular school. And even Honda, in the local Honda dealership, wanted to come in and do some programs and some projects with the kids and their parents. We had social service agencies and providers. We had local businesses. We had individuals who wanted to come in and volunteer in the cafeteria. 624 partners they had. After we went through the process of mapping and assessing and understanding all of those resources and aligning those resources strategically to help the children in the school succeed, that school now has 32 very strategic partners. And it's no longer 624 people throwing arrows at the bullseye. It's a set of 32 strategically aligned partners who are collectively working together to throw a single arrow at the bullseye. That's the profound opportunity that thinking from a collective impact scope offers to communities. How do we stop throwing 37,000 things and hoping something happens into how do we align our efforts and strengthen our muscle so that we have a greater chance, making the one arrow bigger and stronger so that we know we're going to hit the bullseye and achieve greater outcomes. All right. So I'm going to let us, I'm going to back us up just a second, Jamie, because we're at 1:56, and I'm going to give us a quick break before we come back and move into those next 4 or 5 slides, because we're at break time. I'm going to fix my technical difficulties while we're on break, but I want to give everybody an opportunity to get up, stretch your legs. Think about what we've talked about while you're on break. Talk to your partners who are sitting there alongside of you or someone else in the office, and think strategically about who are all those people working in this area in my community who are working towards a common goal. How are we and how are we not currently aligned? And then when we come back from break, we're going to talk about how do we get aligned so that we can increase the muscle and strength and the size of the arrow that we're throwing at the bullseye. So we'll take a break. We'll come back at 2:15. Don't hang up your phones. Don't log out of the webinar. You can just put everything on mute, and we'll pull us back together at 2:15 in about 15 minutes. Break time. Thanks, everybody.
Rhonda, are you still there?
I am. My challenge is that I got kicked off the, I got kicked out of the webinar, but I'm logging back in now.
Okay.
You joined the event, so you want to join it again. Sure.
Yeah, on my end, it's still showing as a active instance, but let's see. You just came through again, so let's try that one.
Okay, it looks like I'm there now, Jamie.
Okay, try to scroll through and see what happens.
Yeah, it's letting me. Yeah, it's allowing me the moderator privileges again. I'm not real sure why it kicked me out. I just wasn't able to advance slides or anything. Okay. So, but I'm back in.
So I see the collective impact. Scroll one more slide, just in case.
One more.
Yeah.
That's where we have the colors with the ladder.
Yes, ma'am. You're good.
Okay. And this is where I'm going to bring us back together on this slide. So, yeah, I knew it was a simple fix. I just didn't want to divert from the content with so many people on the line and try to fix it when we knew we had a break coming up. So we'll start with this slide. That's the 5 conditions when we get back together at 2:15.
Sounds great.
Okay, great. Thanks.
Okay, bye.
Okay.
All right, looks like we're about ready to get started. We've got another minute or so for folks to get back around their desk and their computers. All right, looks like we're at 2:15. If everybody's ready, we'll get back into business here for our next section. All right, so what you see in front of you now is the 5 conditions of collective impact. As I said earlier, John Kenya and his team went around the world and studied collaborative efforts. And they were studying to determine when are collaborations and coalitions effective and when are they not. And what they determined is that successful collaborations and coalitions have these 5 conditions in place. So these 5 conditions are critically important if we are going to achieve collective outcomes. Those 5 conditions are a common agenda, shared measurement and a shared measurement system. Number 3, mutually reinforcing activities.
That'll work. Thank you, Lisa.
Number 4, continuous communication. And then number 5, backbone support organization. And we're going to take a minute on each one of these and talk about what is that condition, what does that mean. So if we look first at agreed upon agenda, that means where we have here that there is agreed upon principles for working together. That's really important because a lot of times we get together in a room and we call ourselves a coalition, but we don't take the time to talk about what does this mean? How are we going to work together? What's the agreement that we're making to each other? So when I've worked with communities as they try to build collective impact efforts, our very first step is I use lots and lots of flip chart paper. Like I wish I had stock in the company because I use that much of it. So I get folks together around the table in a room. I give them all a piece of flip chart paper, and I ask them to write across the top of that piece of paper, what is the name of your agency or your system? So you might be XYZ Behavioral Health Agency, or you might be school district, or you might be city transportation system. Whatever you are, write it across the top of that paper. And then underneath that paper, I ask folks to identify what are you trying to achieve? Why do you exist as an organization or a system? And then if we're there together for a specific goal, let's say reduce prescription drug abuse, I would ask them to write on that piece of paper, what are you doing to reduce prescription drug abuse? And the city transportation department, inevitably somebody like them or someone else will say, well, we're not doing anything. Okay, we'll leave it blank. And then I give people permission to leave any parts of that blank. And we put those flip chart papers on the wall around the room, and we just start talking about who is here, who is in this room. We all agree that we have to reduce prescription drug abuse, right? Even the city transportation department is invested because they have drivers maybe who are showing up under the influence of prescription drugs, or they have people riding city transportation who are under the influence of drugs. Whatever it is, everybody's in the room because they have an invested interest. So the next question that I ask the group, after we understand what everybody is and who they are, I ask the group is, why do you need to reduce prescription drug abuse? How is prescription drug abuse impacting you? And then we move into some conversations about, well, what as a community can we do about it? Now, this is very different than a lot of people approach collaborative work. A lot of times we will go in and say, we were funded by a grant to do XYZ project or achieve XYZ goal. How are you going to help us achieve our goal? That sentence right there kind of eliminates the idea of collective impact, because collective impact is about, it's not my goal as my agency, it's our goal as a community. So if we're going to be successful in achieving collective impact, we have to start with just having conversations. And that's uncomfortable for a lot of people because they want to go into a meeting, they want to have all of the answers, they want to have everything written on paper, everything organized when I walk into the room. Our job is not to have all of the answers, it's to ask really good questions. So step one in building a common agenda is, the question is, who is here and why are you here? Step two is, how are we going to work together? Well, step two is, what are we trying to achieve? And then step three is, how are we going to work together to achieve it? That's how we build a common agenda. And again, very different than going in and say, I have a project that has been funded and I need you to help me. I don't have time to help you do your job. You go do your job, I'll go do mine. We have to move out of that mindset into, why are we here? Why do we have shared ownership? What are we trying to achieve? And how are we going to work together to achieve it? It's a very different approach. If you move down here to bullet number 3, this is my favorite bullet, an agreed upon definition of success. The other challenge I think that communities have in achieving collective impact is that they don't take the time to define success. Oftentimes, whoever the convener of the coalition is will come into the room and say, we will have achieved our goal when we reduce prescription drug abuse by 20%. And so now you're expecting other people to take ownership in a goal that you have dictated. It is very important for communities who are working to achieve collective impact to take time and ask the question to the group. Again, put the flip chart papers up on the wall and start taking notes on your flip chart paper. After you have asked the question, what's the definition of success for our group? It's really important that the group defines what success is. Now, you might not be working with a full-blown coalition, right? It might just be you and one partner, or you and two partners, or you and three partners. That's okay. You still have to take the time to say, how are we going to know when we get there? What is our definition of success? What do we want to achieve by working together? That allowing the community to have ownership in that is what builds a common agenda versus our dictating what success means. So very important that we take the time to have those conversations. If we don't have those conversations, it's very difficult to achieve collective impact because we're still working with a focus on one person's agenda, one person's program, one person's goal. If we have the conversations, we then can build a collective agenda, a collective goal, and a collective aligned set of strategies to achieve the goal. So common agenda is really setting some parameters around how we work together, what our definition of the problem is, what our definition of success is, and how we think about how we work together to achieve it. Condition number 2, that is the idea of shared measurement. And a lot of people shy away from this because they think, oh my gosh, everybody's data sets are in different technology systems. There's no way the data sets can communicate with each other. Okay, that's not where we're going. What we're talking about here is simply sharing data across systems and issues so that I have the ability as the school system to understand law enforcement data. And we as a community can put school system data up against law enforcement data and understand the connection between the two so that we have a deeper, richer understanding of the problem. And a lot of times people will do a community assessment. I know this is true with the Drug-Free Communities program. They have to write an assessment as part of a grant application. And so somebody will sit in their office. I know because I did it. I'm not accusing anybody of anything. I've been in your shoes. I sit in my office and I call the police department and I ask for data and I may or may not get it. I call the hospital and I ask for data and I may or may not get it. I call the school district and I ask for data, and then I get all this data in my office and I try to figure out what it all means. And I'm doing this for the purpose of writing a grant application to send out and get some money to do my program. With the idea of collective impact and shared measurement, it's talking about having partners bring their data to a shared table. It's not me alone trying to decide what all this data means. It's not me alone trying to get somebody else to give me their data. What it is about is everybody bringing their data to the shared table, and then we use it as a learning tool. And out of that, we can create some common outcomes, right? So that our common outcome across systems might be, you know, increasing the number of homes that report that they secure their medications at home. If as a system we agree, if as a collective we agree on that, then we can begin to think about how do we make that happen. And it's not just a single agency that's trying to make it happen, but there's a role, R-O-L-E, a role in that for the school district. There's a role in that for the police department, for doctors, for extended care facilities, nursing homes. There's a role all the way across the community that people can play if they have shared ownership. If they understand, if I'm the school district, I need to understand how locking medications at home is going to help me achieve my goal of educating students. And the only way we're going to get there is if we bring our data to the shared table and we talk about it. Not just having reports and everybody's eyes glaze over because it's boring and nobody really wants to talk about it, whatever it is. We actually have some rich, dynamic community conversations about the data and what the data means to our shared work together. So it's not, I mean, in an ideal world, you would have common technology and everybody adds their data into one database, but, you know, that's an ideal world. That feels like Dr. Seuss land to me because it feels too far away and unrealistic. What we really are talking about is, as a community, come together. If we go back to the beginning of our conversation where we talk about infusing new research and disparity and health equity, it's one thing to know that we have 168 over the county that I live in 2017 had 168 overdose deaths in 2017. 168. So we got together as a community, and the first question we asked is, who are these 168 people who lost their lives? And we learned some pretty profound things. We learned that all but 3 of those 168 people were white. We learned that 72% of those 168 people were parents. We learned some pretty profound things as a community when we sat down and began to talk about and think about and work with the data so that we then can understand how, okay, I as a school district now have those children in my classrooms that are showing up on the doorsteps of your social service agencies who are now being raised by grandparents who are grieving the loss of their child, who may be ending up in the juvenile justice system. And we begin to understand the issue across systems. That's the value and the richness of data when we use it to learn and for discussion versus just pile it into an assessment or an evaluation report. Third condition of collective impact is mutually reinforcing activities, and this is another very important concept to understand. When we're talking about collective impact, we're not talking necessarily about partners who are coming in to do new and different things. When we talk about mutually reinforcing activities, we talk about each member, each organization does what they already do well. Remember those silos of excellence that I talked about? Probably in your community, the police department are doing what they do well. Probably the emergency rooms are doing what they do well. Probably the school district is doing what they do well. We're not asking them to do something different than what they already do. What we are asking them to do is to figure out how we can align our efforts better and more efficiently. So I like to talk about differentiate. If we move all the way down, I'm going to circle the bullet here. Differentiate before we integrate. Step number 1, as I talked about before, is put your flip chart paper on the wall. List what people are doing to achieve the goal that you're working towards. Differentiate and value what everybody's already doing. A lot of times in a community, the perception is if I join a collaborative or I join a coalition or a collective impact initiative, somebody's going to ask me to do more than I'm already doing, or do a new program, or sit at a health fair table for them, or whatever it might be. Step number 1 is differentiate. Talk about who is doing what and value what people are doing. And then we could begin to align more efficiently. I'm going to give you an example, a little off topic from the opiate epidemic, but I actually was in a meeting this morning, and this community received a substantial amount of money over the course of 4 years to infuse school-based mental health in the elementary school so that mental health services could be provided to elementary school children. In the community, in the meeting this morning, there was lots of conversation about the mental health providers now are at capacity. They can't take on any more children, and there are many, many more requests for mental health services are coming in. So somebody in the group asked, okay, what are the issues that the kids are coming with? And she talked about, the mental health provider that was there talked about her caseload is primarily kindergartners and first graders who don't have the ability to self-regulate and do not have the social skills to interact successfully in the classroom. As we had that conversation, there was someone there from the health department who said, we have funding to provide a preschool program that teaches children self-regulation skills that for 2 years, we have not used the funding because we've not been able to make connections into the preschool. So by the end of the meeting, what they talked about was partnering the mental health service provider with the health department, and the school superintendent was also there, and they talked about how do we use these resources that already exist in our community that are going unused to meet a critical need. Nobody in that scenario was asked to do anything necessarily different than what they already do. But we are now going to align mental health, school-based mental health care with educational outcomes with health department resources to achieve a bigger impact. In the case of prescription drug abuse, if we know one of the primary access points is, let's say, long-term care facilities and the unused medications are being removed from long-term care facilities and are ending up on the streets, then maybe when we go back to our Mapping My Connections sheet, we need to think about how can we partner with and align with the long-term care facilities in our community. How can we educate the nurses, proper disposal, all of those sorts of things. How can we have access to family members in the long-term care facilities? So it's that not everybody is going to do a new program. It's more about how can we understand who the players are and line them up so that we're working together to use the resources that we have in new and important ways. So that's the idea of mutually reinforcing activities. The fourth condition that is necessary to achieve collective impact is continuous communication. And this is, the way that I define this for folks is, it's not enough to only work together when we're together in a meeting. We have to work together outside of the meeting space. If our meetings are what they are supposed to be, then people will work together outside of the meeting. So the question is, what are our meetings supposed to be? Meetings are supposed to be dynamic interactions between the people around the table. I don't know about you, but I have had points in my career where I would pray on the way to my very own meeting that I would get a flat tire so that I didn't have to go to my very own meeting, because my very own meetings were that painful and that boring. Because what I did is I went in with an agenda. I was the one who did all of the talking. Anything anybody needed to know, I had printed out on a piece of paper. If anybody else in the room talked, it was just simply them reporting. They were talking to the group. Everybody who talked in the meeting was talking to the group. In a dynamic space where collective impact can happen, group time, meeting time is spent having dynamic, necessary conversations so that new ideas and new strategies can emerge that will motivate people to act between meetings. And that again, is a pretty profound shift in the way where we used to work to where we're going to work if we're going to achieve collective impact. We can't just sit around with people providing reports that could have been sent out in an email. Our agenda oftentimes is a series of necessary questions that need to be answered. So for example, an opiate task force might ask the question, in 2017 we had 168 deaths. We equipped all of our first responders with Narcan. We decreased from 248 deaths in 2016 to 168 in 2017, but we still have 168. Where do we go now? What do we do next? And then the group has an opportunity to have a discussion about where do we go and what do we do next. Instead of just reporting out those numbers and saying, okay, next agenda item. Or if we have a project like many of you are working on where we have to distribute lockboxes into homes, the agenda item, instead of coming in and saying, hi, my name is Joe, I've been funded by the state of North Carolina, I have 148 lockboxes to pass out in the community, who wants them? We might approach an agenda item in a space that collective impact can occur and would motivate continuous communication beyond the meeting by saying, we know that securing medication reduces access. Our goal is to have homes secure medications, and one pathway to doing that is using a lockbox. Does anybody here have a lockbox in their home? How might we motivate people in our community to use the lockbox? What's the best way to distribute lockboxes in our community? Because it's amazing when we allow people to share that kind of information, they think would motivate people, where they think people might pick up a lockbox, and engaging people in conversation instead of just saying, here's what I have, will you take it? When we have those kind of conversations, people are far more likely to engage in activity between the meetings. So the idea and the concept of continuous communication that happens even when we're not together in the same room. And then our last and fifth condition of collective impact is the idea of backbone support. Now, backbone support this is a very busy slide. You are going to get a copy of this slide, so you're going to get to read all of the small words, and I promise not to read them to you in this webinar. But there are some functions of a backbone. The first one is to guide the vision and the strategy, not create it. The community says what the vision and the strategy is, and then the backbone support is the paid staff that keeps the gears running in between meetings, connecting with people, getting people the support that they need. But the community creates the vision and the strategy. The backbone of support is not necessarily the program provider. They support the aligned activities of the partners who are around the table. If the school district says we're going to do X, Y, Z in partnership with the health department, then the backbone organization is the one who is following up the school district and the health department to see if they need any support or help to get that done. One of the key implications for the success of a collective impact effort is whether or not there are dedicated staff hours to support the work of the partners. Not the program providers, not the educators, not the police, but someone whose job it is to facilitate the process. And that's a hard thing for communities to fund and to come up with. But when we look at what works and what doesn't work in collective impact efforts, if you have paid staff who does things like support the aligned activities, focus on establishing the shared measurement system, motivating the community to get engaged by building public will, understanding the policy landscape and stewarding the policies that the collective wants to be a part of. That is a position in and of itself, and there is a significant and clearly defined skill set that is necessary to get that work done. It's not oftentimes a junior staff person who used to be a program provider and is now expected to facilitate this process. It's a very sophisticated skill set, a specific skill set, and the community collectively agrees that, yes, we need somebody in this space to facilitate and support our processes. When we think about the staff rule, there are some misperceptions about that staff rule, and I want to make sure that we talk about those very quickly. The backbone organization does not set the agenda for the group. The misperception is that the backbone organization does. They do not. The community sets the agenda. The backbone organization does not decide on the solutions. The solutions emerge out of the interaction of the people around the table. The backbone organization does not receive all of the funding. Collective impact grant applications can go out from the backbone organization, but 20% of that funding goes to one partner, 20% goes to another partner, 20% goes to another partner. So common or collective grant applications coming out from a community and then dispersed among the partners is very frequent in collective impact initiatives. It's not just that whoever the fiscal agent is or the backbone, they get all of the money. That is not the case. The role of the backbone can be self-appointed. No, it has to be selected by the community. And the role of the backbone isn't fundamentally different from business as usual in terms of staffing, time, and resources. And what we need here is that the backbone organization needs to understand that facilitating a collective impact effort is critically important, and it needs dedicated staff hours, not just added on to something somebody is already doing. The staff people in a collective impact, we need to, if we're going to have collective impact, the role of staff needs to move from the idea and the concept that the staff person is the hero, they know everything, they own everything, they protect what they're doing, and that it's very simple to staff a collective impact effort. We have to move out of that. The leadership and the staffing of a collective impact effort is hosting. You are the host of a community group. You are not the hero who knows everything. You are the host who asks very good questions. You don't manage the process, you facilitate group work. You don't own everything, you facilitate community sharing. You embrace and cultivate emerging ideas. You encourage social innovation, and you understand that the issue of community working together to address a social problem is very complex. It's not simple. It's not something that is going to be solved in a day. It's not something that's going to be solved in a year. It's ongoing work and effort in the community that embraces complexity and allows for emergence and emerging ideas that come out of the interactions in the group. So I'm going to give everybody a chance to take a deep breath, and I'm going to back us up a couple of slides because I want to revisit this first slide that talks about the 5 conditions. Remembering that the 5 conditions of collective impact are the conditions that have to exist if we're going to achieve the outcomes we seek to achieve by working together. Shared agenda, shared measurement, mutually reinforcing activities, continuous communication, and backbone support. All right, now I'm going to move us on. What you see in front of you, so let's talk about what this looks like in your community and how do you actually make this happen. What you see in front of you is a logic model. It may look a little differently than your logic model because every funder requires a logic model that has a little bit different. Oh, let me see what you have in front of you. Oh, gotcha. So I'm going to take us back to the logic model because I see that we went run too far. All right. So let's understand what this is. I'm going to take a second and I'm going to get out my colored pointer and we're going to talk about what this is. In this first box right here is the problem that we're trying to address. For this example, we're going to put in prescription drug abuse. So the problem is too many people in our community are abusing prescription drugs. We have too many overdose deaths. Whatever our problem is, go back to your mapping your connections worksheet and whatever you put in the center of your paper, that's what goes here in this first box. So we ask the question then, if we have a problem with prescription drug abuse, why does that problem exist? And that's where we go to our second line of boxes. Oftentimes, these are the risk factors. Science has already told us what are the risk factors, and there are some that are even agreed upon or dictated by the funder. So we have a problem with prescription drug abuse. Why do we have a problem with prescription drug abuse? We have a problem with prescription drug abuse. Why do we have a problem with prescription drugs? Because they're easily accessible. How are they accessible? There's social access in the home, from peers, parties, so on and so forth. And then there's retail access from the prescribers and so on and so forth. So we have the problem and we have the risk factors. We have a problem, why? Because of social access and because of retail access. This third box is a critically important box because this set of boxes defines the local manifestations of the risk factors. So we have a problem. Why? Because of social access. Then we ask the question of, but why here? And that means in my community, what are the points of social access? So if we look at this example here, it's community residents sell prescriptions to supplement their income, and prescriptions are not monitored and stored in secure locations in the home. So let's go all the way back to the left. Let me choose something that's a little more visible here. Here we go. So we have a problem, prescription drug abuse. Why? Because of social access and retail access. What does social access look like in my county? Residents sell their prescriptions to supplement their income, and prescriptions are easily available in the home because they're not monitored and secured. The theory of change in a collaborative effort or collective effort is that the point of impact, sweet spot for making a difference, is right here. It's in this set of boxes that come at the end. A lot of times when you ask people what strategies they're doing to achieve, they're talking about achieving change all the way down here. Why do you do what you're doing? We're going to reduce prescription drug abuse. That's too far away. If we're going to employ a set of strategies, we're going to employ strategies to change the conditions that exist in the community. This box all the way down here at the end. So if we want to create change, this box at the end, the local conditions down here, if we do our work and we do our work well, we will see change in these conditions in 12 to 24 months. I'm going to draw another color here because this set of boxes is really important. If we change multiple local conditions, then in 24 to 48 months, we will see these risk factors decrease. If we decrease multiple risk factors, we will then decrease the problem behavior. So if we're going to apply the theory of change for community change and successfully achieving change in a social problem, we start by addressing these local conditions. And we create a set of strategies that address the condition, not address the problem all the way down at the end. Because we got to change the conditions to reduce the risk factors. We reduce the risk factors to reduce the problem. So when we think about what strategies are we employing, we're employing strategies, for example, to have community residents stop selling their prescription drugs to supplement their income. So we're employing strategies to change this. We're employing this set of strategies to change this, and we're employing this set of strategies to change this. That's very different than thinking our strategies are going to change this. We have to think about aligning our strategies between partners right here. Now, if we know that no single strategy, I'm going to move real quick to the next one, no single strategy is going to achieve the change that we want to achieve. We have to engage in a comprehensive, aligned set of strategies across systems and issues. Most communities that I work with, in 2012, I slept in 22 states. I was on the ground in 22 states working with communities as they tried to achieve collective impact. And what I found in the majority of those communities is that they were really, really busy. They had lots and lots of things that they were doing, but they weren't very effective. They were just doing a lot of things. So if we're going to move from being busy to being effective, we have to first realize that we're trying to change the conditions in the community, and we're employing strategies to change those conditions, and that the first thing that we're going to see change are the conditions. And second, we have to realize that we have to have a comprehensive set of aligned strategies. We can't just do one program and expect prescription drug abuse to stop. We have to change the conditions, reduce the risk factors, and then the problem of prescription drug abuse is going to stop. We have to move from being busy. We can all be really, really busy, but we have to become effective. All right. Sorry about that, I had a sneeze. Now, my friend Paul Evanson, some of you may know him if you've been in the world of drug-free communities for a while. He says that your community is perfectly engineered to achieve the results you are currently achieving. If we were all together in a room, I would ask you what he means by that. What he means is basically, if you always do what you've always done, you'll always get what you always got. If you have a problem with prescription drug abuse in your community, the way that you're managing it is resulting in what you got. If you want to get something different, if you want to reduce the problem of prescription drug abuse, then we got to do something different. We got to understand the theory of change. We have to align our strategies, understand the theory of change, align our strategies to become more effective, and do it in new and innovative ways. My favorite story here is Apollo 13. On Apollo 13, we had astronauts out in space with something broken, and they couldn't get back in unless they fixed it. The problem was they were in outer space, and we could not send them any tools or any materials to fix the problem that they had. They had to take everything that they already had, everything that existed in that capsule, and figure out how to use it in new and innovative ways to fix the problem that they had. They could not get back to Earth using their resources the way that they had always used them. They had to use their existing resources in new ways to fix the problem to get back to Earth. That's exactly what the challenge is for communities with collective impact. We have to understand what our resources are, and we have to use them in new and different ways to achieve a different outcome. Just like the astronauts stuck up in space. We're stuck in we're almost on a hamster wheel of challenges in our community. So the challenge is, how do we use what we already have in new and different ways? This challenges us to do what we like to talk about as social innovation. It's new ideas that meet social needs, create new social relationships or collaborations. They're good for society, and they enhance society's capacity to act. We need to be innovators, like the astronauts of Apollo 13. We have to first understand what are the resources that exist in our community, who are the partners and the players that are in the space, and how do we realign and innovate among those partners to change the conditions that exist. How do we do that? We've talked about it a lot already. We get those people together in the room, we stop acting the way that we've always acted, begin to act in new and innovative ways, talk to each other, have interaction, learn together, problem solve together, and we can get to a space of social innovation. Linking and aligning partners for collective impact, again, requires innovation, and it's not always innovation with new resources or services, but it's new ways of aligning existing resources and services. It's about transformative change in programs, in policies, and practices. I have worked in communities where partners could not work together because their institutional policy said that they couldn't. We may need to change policies about how and when we provide programs. The meeting that I talked about being in this morning, where they were trying to provide school-based mental health, the policy in that county prior to our work together was that publicly funded mental health service providers provided services in the community. So the school had to refer children from the school to community services. And the follow-through rate was very, very, very low, where parents were not taking their children to community-based mental health services. So there was a policy change that had to happen from the county funder to the provider to be able to provide those services within the school building. There was a policy change in the school district that had to happen for those schools to be allowed to be provided within the school building. So when we talk about policy, we're not always talking about a new law. Sometimes it's policy changes at the institution or system level that it has to happen for a new practice, providing mental health services in schools, to happen. So it's transformative change. Complexity, the unpredictable interactions of multiple players in a system. Emergence, those are the new ideas that come out of people working together in new ways. The partners in collective impact, this is an important piece. If we are going to achieve collective impact, the partners have to be key decision makers, funders, policymakers, executive level leaders, and they have to share an urgency or a focus for change. A lot of times we get together in a room, we all sit alongside of each other and call ourselves a coalition, but we don't really have the authority or the power to make decisions or changes in the community. So we have to get our key decision makers together in the room, along with our funders. When I was working with the Coalition for a Drug-Free Greater Cincinnati, we had a lot of local funders, corporations. We had Procter & Gamble, we had Chiquita Banana, we had the Castellini Group, we had, I can't think of the name of the big uniform company, but we had some huge companies that provided funding into the community. Then we had the Health Foundation, we had the Greater Cincinnati Foundation, we had all kinds of community foundations that provided money into the community. And every one of those funding groups had a different funding process. They had different timelines and schedules, they had different applications, they had different requirements for evaluation. Everyone was different, and they all funded at 12 years, or I'm sorry, at 12 months. They funded for 1 year. We know that this kind of change that we're talking about is going to take longer than a year, right? It's going to take us a couple of years to get to the outcomes that we want to achieve, the long-term outcomes. So if we were going to achieve it, we had to work with funders to change their practices and how they were funding. We moved to a place in Greater Cincinnati where we had common grant applications, common funding processes between the funding entities within the city. We moved from single-year funding to multi-year funding. In many cases, it was 3-year funding streams among our corporate and private funders in the Cincinnati area. And that came from the community working together, working with the funders so that there was a common understanding that we needed to change practice. We needed to change the way we were putting local dollars into local communities. So when we think about what can we do, oftentimes it's not just about implementing a bunch of programs. Remember the arrows and the bullseyes earlier. It's about creating transformational change among key decision leaders, among funders, among executive level decision makers, to be able to create large space for organizations and systems to work together. So when we think about who are the partners in collective impact, yes, there's space for the frontline workers. They have to be working together as well. But we also need to engage key decision makers, funders, and policymakers. If we're going to be successful, we have to focus on assets and community resources. We have to ask some critical conversations, and these are great discussion starters in our meetings. How can organizations delivering services be arranged differently to achieve a greater impact? If we have 10 people providing prevention services in our county, what would happen if we called a meeting and all 10 of those prevention service providers came together and we asked the question, how can we arrange ourselves a little differently to achieve a greater impact? Do we really need this mix of services, or could resources be deployed more effectively? I was in a particular community a couple of months ago. They got funding to do a new program, classroom management program. When they interviewed teachers at the end of the funding, the teacher said, oh my God, this really works. What we were working before wasn't working. This community was now asking itself, how are we going to sustain this classroom management tool with our teachers after the grant is over? My question to them was, what were you doing before that wasn't working? And how were you paying for it? And how about if we take the money that you were using to pay for what wasn't working, and we shut down what wasn't working, and we use the money to pay for what is working? And that was kind of a profound challenge to the community, and they did exactly that. They reassigned resources. They still use those resources for classroom management, but they assigned them for new classroom management tools versus the classroom management tools they had been using before that didn't work. So a very important question, do we really need this mix of services, or could resources be deployed more effectively? What policies are preventing true change from happening? It's interesting when you put some system leaders together in a room and ask, why don't we work together more efficiently? And start having some of those conversations. What power dynamics are in place? Are we keeping our eye on the goal or the progress? That's a hard one sometimes for people to talk about, but it's a necessary conversation. And am I working to maintain my job or to change my community? And if we put our eye on community change versus just our job, then our opportunity to create large-scale change is much greater. I did some reading. I'm always reading, trying to learn what's new and relevant in our field. And the Stanford Social Innovation Review, which I quoted earlier, and they're the ones that printed the first article about collective impact, they recently printed an article about what makes the most successful nonprofit organizations successful. And one of the most important characteristics of successful nonprofits is that they come outside of their own walls and they partner with other entities in the community. So overall ability to achieve goals. We now know when we study successful nonprofits, if we can stop thinking just about ourselves and about our work and about our goals and our funding, and begin to think about how our work and our goals mixes with others to achieve change in the community, and our opportunity is our opportunity is much greater to achieve the success we're trying to achieve. So we talked a little bit about this before, the mutually reinforcing activities. We have to differentiate the line. Each member does what he or she does well. We have to build trust, analyze fast, everything is a hypothesis. And we have to leverage tension. Sometimes the tensions are good. I was working in a community that was getting grant funding was running out. They were trying to figure out how to maintain things, and they had a printed resource guide. And the community said, we have to keep printing the resource guide for our community. One of the people at the table was a funder who had a call center, and his call center was supposed to help people find resources in the community. And so he said in the meeting, why do we need the printed resource guide when we already have a call center resource guide? And there was a lot of uncomfortable people in the room. And I sensed the uncomfortableness among the people in the room. And I said, and I get to go away. So it doesn't matter if people get mad at me when I'm facilitating. So I wasn't afraid to ask the question, okay, people seem to be uncomfortable. What's the uncomfortableness that's going on in the room? And after about 10 minutes of discussion, what they were able to say out loud was that the resources that the call center is using are outdated and irrelevant to the resources that people in the community are seeking. The printed resource guide gets updated every quarter, and the resources are more relevant and are current. What happened as a result of that was that the funder who funded the call center said, okay, well, obviously we need to update our resources in the resource center and train our callers to connect people better, but we can use resources to do that versus continue to fund a completely dysfunctional call center that everybody around the table was afraid to say it's dysfunctional. And they were going to put more money in the community to print a resource guide when really they could just update their call center. That idea of leveraging tensions is let's not shy away from things that are difficult or uncomfortable. Let's put it out there and talk about it as a community in a meeting. And we can't really get to mutually reinforcing activities if we're not really to have some difficult conversations and hold each other accountable. So the last idea here before we take a break is I want to make sure that we understand, and I think we've been clear on the webinar thus far, is that this is about a growth trajectory. We're infusing new research, new funding, emerging trends, shifting demographics, new leadership into what we already do. It doesn't mean that we start over. If the new trend in funding is trauma-related care, if the new trend in funding is heroin, if the new trend in funding is domestic violence, whatever it is, let's not shut down everything we're doing as a community and throw the baby out the bathwater. Let's take that back to our community collective group and say, here's a new idea, here's a new thought. So for example, with this collective impact piece, instead of saying, oh gosh, we're doing it all wrong, now we gotta go back and start over, no you don't. We go back to our partners, we go back to our coalition, and we begin to ask questions and have conversations about how are we working together to achieve collective impact? How could we do that better or different? So we take the new knowledge that we gained today and we advance and we evolve what work we were doing yesterday so that tomorrow we achieve greater outcomes. We don't just start over. We infuse it into the work that we're doing, and we see it as a growth trajectory in our community. And we don't throw the baby out with the bathwater. All right, so that brings us to our second break. I don't see any questions, Jamie, in either the chat box or the Q&A box.
We do have one question.
I'm going to challenge folks while you're on your 15-minute break here. I want you to think about the conversations that we've had and the information that's been presented. I want you to think about your connections that you drew on your map. I want you to think about, remember all the way back in the first 5 minutes, your vision for success and what you need to get out of this training to achieve success. And I'm hoping that we'll come back from break with a couple of good questions or comments about something that you learned or that you found helpful. More information that you need. So you have homework during this 15-minute break, and that is review your pieces, compare it to the content, and come back with some really good questions about what you're needing or feedback about where you want to go. So it's 3:08, we'll make that 3:10. We'll take a break for 15, no, let's take about a 10-minute break. Let's take a break until 3:20. So we'll get started back at 3:20, which will give us 40 minutes to finish up for the afternoon. All right, ready, break, go.
Hey, Rhonda?
Yes.
We do have one Q&A question that you might want to take a look at under the Q&A box.
Okay, I'm gonna use that for my homework during my break. All right, I'm gonna give that some thought. Okay.
Well, you have to.
All right, so it's 3:19. We'll take a minute as folks settle back into their desk, and we'll get started back up. All right, welcome back, everybody. We're on to the home stretch of this 3-hour webinar. Proud of you all for staying with it all the way to the end. I am going to take a second before we get into the rest of our content and address a question that was posed in the question and answer box. And the question that was posed is, would untreated substance use disorders also align with social and retail access as a reason we have a prescription drug abuse problem? So bear with me as I quickly back up a few slides. Oops, look, I went too far. That was my quick finger. Sorry about that. All right, so here we are. Let me eliminate the animations I have there. All right, so the question is, would untreated substance use disorders also align with social and retail access as a reason we have a prescription drug abuse problem? The answer to that question is that there would be an additional box. And in that box, it would say untreated substance abuse disorders. And then there would be a set of strategies. Oh, we got lots of feedback. Somebody's not on mute. Oh, there we go. Thank you. So there would be a set of strategies then that are aligned to change the untreated substance use disorders in the community. Because each one of these boxes needs its own individual set of strategies, and it needs multiple strategies, not just information, not just education, not just environmental strategies. It needs a set of strategies, an aligned set of strategies to make a change. The strategies that you would use to treat untreated substance use disorders would be different than the strategies that you would use to get residents to lock up their medicine in the homes. So you would have a different risk factor here, and that risk factor would be related to, let's say, if we put in there untreated substance use disorders, and then one of the reasons would be that treatment facilities are at capacity, or the local manifestation might be that local residents don't seek treatment, or local residents are not aware of treatment options, or so it would be a whole nother, what I would call, line of logic. It's not necessarily related to social access or retail access. but it definitely, if we're going to reduce prescription drug abuse, we have to deal with untreated substance use disorders and why we have untreated substance use disorders in our community. And we would align a set of strategies to address that line of logic. So that's a very, very good question. And my hope and the outcome of this conversation here is that we understand that we have to identify each issue and create a set of strategies as a community to change the individual issues. You can't just engage in one strategy and expect all of those boxes to change. We have to understand each box individually and create strategies for each of those boxes. So, Elizabeth, hopefully that answers your question. Is it a part of the big picture? Does it need to be part of the logic model? Absolutely. Is it separate from social access and retail access? Yes, it is, absolutely. And it warrants its own set of strategies to create the change we seek to change. All right, anybody else have any good questions you want to offer up in the question and answer? Because you all probably can tell by now that I could talk about this stuff for days and days and days. But it's only relevant if it's answering the questions that you have. So as we move into our last half hour, make sure you're posing those questions so that I know that we're getting you the information that we need. So this next section, as we talked about when we forecasted the agenda, is going to talk about what are some of the tools and the techniques that you can use in your community to move from where you are now to where you want to go. And I'm going to ask a couple of questions. You're not going to take a lot of time to answer them. It's difficult with this many people in the webinar. So I just want to pose them, and I want you all to consider them. The first one is, how does your collective group, how do you and your partners use your FaceTime? And we talked about this a little bit earlier, and that is, when you get together in a room, how do you spend your time? Do you spend your time listening and talking to the group, or do you spend your time engaged in dialogue and discussion? I challenge you, when you're meeting with a partner or you're meeting with a group, that you move from a place where you're talking to the group into a place where you're having conversations with the group. And let the resolutions, let the solutions emerge out of that interaction, out of that FaceTime, versus coming in with a predetermined set of strategies that you want to have happen. The second question is, what about your meeting is productive? And then the third, what about your meeting is not productive? So what's working in your meeting? What gets you where you want to go? And what about your meeting doesn't get you where you want to go? And my challenge to you is change it. If it's not working, change it. My next favorite cartoon is And We All Lived Profitably After, but the point here being, you've got a person who is talking to a group, and a lot of times this is what happens in our meetings. When we get together with our partners, we talk to them instead of talking with them. I ask the question all the time when I'm training, what's the definition of insanity? Well, the definition of insanity is doing the same thing over and over and expecting different results. My joke is, after being a coalition leader for 30 years trying to achieve collective impact, it's also too often the definition of a coalition, doing the same thing over and over and expecting different results. It's interesting when I go in and I work with a community or a coalition, and I ask them for the meeting agendas from their last 3 meetings and their minutes. And I look at their meeting agenda and their minutes, and they basically are cutting and pasting everything from one meeting to the next. They just change the date and the next meeting date. They just cut and paste from meeting to meeting to meeting. And I read the minutes, and there's not a lot of movement. And so we may have 3 months invested in 3 meetings, and there's not any movement. Nothing is happening. And sometimes that's because we're stuck in the place of insanity when we just keep doing the same thing, cutting and pasting our agenda, and hoping we get a flat tire on the way so we don't have to go to the meeting. We got to get out of that space. If we want something different, we got to do something different. So the next series of slides are really talking about some meeting management tools and how do you create an agenda that allows things to happen, that keeps things moving. Now, in the interest of time, we're not going to go through each one of those slides individually, and we're not going to spend a great deal of time on them. But I included them in this PowerPoint. When you receive the PowerPoint for this webinar, you'll have a chance to review them. But more than that, what I want to say to you is if you're struggling, if you're stuck, you feel like you're having meetings that are not producing outcomes, you feel like you're using your meetings and all you are is busy and not effective, you're willing to admit to yourself that you're cutting and pasting your agenda from week after week, or month after month, and year after year, if you're in that place, part of my services is doing this webinar is to provide technical assistance. And so we will schedule a 1-hour call. If you read through these slides and you're like, man, we got to beef up our meetings, we're not getting anywhere, or we get a bunch of people in the room and nobody talks, or I don't know how to create an agenda that gets us to outcomes, you shoot me an email and you say, I want an hour of technical assistance. And we will talk about your community, about your coalition, about your partners specifically, which is very hard to do on a webinar. And the fact that there's 80 people on this webinar shows me there's an interest in the material. You guys want to know this and you want to be able to use it. So what I'm offering, and is what has been involved in this agreement, is that I will provide one-on-one technical assistance to those of you who ask for it. So you can even ask for it in the chat box while we're on the webinar here if you like. But a lot of times when we talk about meeting management, each community is uniquely different and has different challenges with their meetings. So the information is relevant, but where we really, really make a difference is when we do those one-on-one technical assistance calls. And you tell me about your meeting. Tell me what happened. Show me your last 3 agendas, and then we'll work together one-on-one to create a dynamic agenda that will produce dynamic interaction between your partners and get you faster to outcomes. So I say all of that. If meeting management and meeting creation and how you spend your time together is your challenge, then please look through the slides and then feel free to reach out to me, and we will schedule a technical assistance call. All right, so when we think about how do we manage our meetings, we got to move from a place where the staff is not doing all the work, members are not seen as advisors but active partners. We have to get to a place where we have more consistent meeting attendance. We have fewer meetings, but we achieve more. And we have to move out of assessment and planning and into action. We have to get to a place where our collective impact can, in fact, demonstrate outcomes. It has to move. It's got to keep moving. If I keep coming to the same meeting and nothing ever happens as a result of what we're talking about, I'm not coming back. We're going to lose partners. We're going to lose people. When we think about facilitating effective meetings, there's 4 considerations. The first one is establish an action-oriented agenda. The second one is make sure the membership is engaged and not just listening. The third one is determine what and when items should go to committees or work groups. And the fourth one is be clear about what the role of staff is in a meeting. There are some slides here that look at transitioning from our cut and paste agendas into agendas that are more effective and will get us to outcomes. We move from just discussing things and talking about things to action planning, delegation of responsibilities. That's very important if we're going to get to outcomes and use our meetings efficiently. When we set the agenda, we need to make sure that the agenda items reflect the current work of the coalition. This one is always amazing to me. If we have goals that we're trying to achieve, let's say we're trying to increase the number of homes that are securing their prescriptions. And then I get to the meeting and the agenda is committee report after committee report after committee report after committee report. You're not going to get to outcomes. The agenda item, what shows up on the agenda is, how do we increase the number of homes securing prescription drugs? And we set aside 15 minutes for that. If we're trying to minimize the amount of homes or families that are selling prescription drugs to supplement their income, then that's the agenda item. That's what shows up on the agenda, not just committee report after committee report. sometimes we get stuck understanding that our coalition or our collective impact effort is a nonprofit organization. It's not supposed to be run like a nonprofit organization. It's supposed to be run like a collective impact effort. And so when we set an agenda, put the things on the agenda that need to be discussed by the people around the table. It's really important that we don't overschedule. If we try to do too much in a meeting, we're not going to spend enough time doing what we need to do to get to the outcomes. We're going to end up being really busy because we're doing too much instead of doing a few things that actually make a difference. It's very important that we don't hold unnecessary meetings. If the meeting doesn't have a goal or purpose, don't have the meeting. If we're not clear about what the goal or the purpose of the meeting is, don't hold it. If we have an opportunity to have a meeting, make sure that we use the meeting in a way that makes a difference. I have been invited, let's say, to speak to the Chamber of Commerce. Many of us have been asked to speak to groups in our community about the issue that we're working on. And we will go in, we'll take hours preparing a 20-minute presentation, and we'll go in and do the presentation, and the Chamber of Commerce thanks me politely, and I go on my way, and that's the end of the relationship. That's not collective impact, that's insanity. Instead, what we can do is we can go into that 20-minute window that we have, define the issue as we see it, 168 opiate deaths, all occurring in one zip code in the county. We know that we have patients who are being overprescribed. We know that we have families that are selling their medications, and we know that medications are not stored in the home. I've now spent 5 minutes framing the problem from our perspective. The last 15 minutes, I'm going to use asking good questions, engaging the people in the Chamber of Commerce in conversations with me about the issue. What do you think of the prescription drug abuse problem? How does the prescription drug abuse problem affect businesses? If we were going to get families to secure medications in their home, what are the strategies that we could use to do that? So it's not just me standing in front of a meeting, in front of the room, holding a useless meeting where I'm saying something to them. It becomes a necessary dynamic interaction between people in the community, where I'm asking really good questions, and they're becoming a part of the ideas, a part of the solutions, and generating energy around the issue. It's really easy to sit and listen and dismiss it when you go away. But if we could talk about it, then we have some shared ownership. It's important to not set an agenda that requires members to be active, do set an agenda that requires members to be active participants. Now, I've been in rooms full of people, let's say the Chamber of Commerce, actually, I presented the results of the student drug use data one year to the Cincinnati Bar Association, and I had about 68 attorneys in the room. And so I posed questions. We saw a significant increase in drug use, particularly alcohol use between the 8th and 9th grades. We had 6% of 8th graders who reported alcohol use, and then 23% of freshmen who reported alcohol use. That's like fourfold increase in alcohol use. So when I went in to the attorneys and I presented the data, and then I asked them, you know, from your perspective, in your profession, in your families, in your communities, why is there such a significant increase between the 8th grade and the 9th grade? And they all just looked at me and it's like deer in the headlights. Nobody had anything to say. So instead of moving on to the next question, I challenged the group. They were all sitting at tables of 5 or 6, 7 people at a table, and I gave them all 3 minutes as a table to consider the question that I posed to them, and then I asked each of the tables to report out to the large group. And we ended up with some incredible conversation and incredible insights that were really culturally relevant. Like the Northern Kentucky, we had a couple of Northern Kentucky folks that talked about field parties, and some of you probably know what field parties are, and that's where all the kids get together in a field out in the middle of nowhere, and they unload the keg, and everybody stands around and gets drunk. And you can't go to a field party until you're in high school. So 8th graders aren't invited to field parties, but freshmen are, and so we had a lot more freshmen drinking. That was very relevant to this particular geographic area of my service region, but that was information that came out of the conversation with the Cincinnati Bar Association. Now, that was validated when we had data conversations with kids. But the important thing there was I posed the question to the group. They didn't answer it. They had no interest in talking to me. But when I let them talk to each other about the data point, they generated some really great information. And also then the question became, I had other questions that I threw away because my next question to them was, what are we going to do about that? How do we prevent that from happening? And so they then were able to generate some ideas about what potential solutions are. So when we think about meeting agendas, those are examples of talking to external groups, but it's the same kind of idea when you're in your coalition or in your collaboration. Ask good questions, let people talk, and if they look at you like you're silly and they don't want to talk to you, split them into small groups. Ask them to pose questions. There are ways to do some group management to get people involved, engaged in the conversation. So we have a couple of slides here that look at specific agenda and agenda items, and you're welcome to go through those, but that really is where the agenda items are reflective of the work of the coalition. From month to month, each agenda item should progress and not remain the same. So if you're cutting and pasting your agenda and it looks exactly like it did 6 months ago, you're in the place of insanity. If you still have partner with schools to pass out block boxes and there's no movement in that and it just keeps being put on the agenda and nobody is addressing it and you're not talking about it and planning and doing, you're in the place of insanity. So from month to month, the agenda should progress. It should not remain the same. If the action is completed, take it off the agenda. If there are barriers to completion, then talk about how we're going to overcome the barriers. If we just simply can't do it, or we decide it's unnecessary, take it off the agenda. If it needs more time, send it to the committee. Oftentimes in a community, I will host, in communities that I'm working in as a paid staff person, or if I'm working with other communities, we will host think tanks or discussion circles or focus groups, whatever it is that we want to call them. You know, we've had judicial discussion groups where we ask representatives from the judicial community to meet with us for a series of 3 meetings to talk about the prescription drug abuse problem. We've convened treatment providers. Instead of asking people to volunteer to be a part of Collective Impact or volunteer to be a part of a coalition, because we know when you join a coalition, you don't get out until one of 2 things happens. Either you die or you move to another country. Because like once you sign up for a coalition, you're in it for life. And people are afraid to sign up because oftentimes coalitions don't really accomplish anything and they can't figure out how to get out of it, right? So if you invite people to come to a series of 3 meetings, give me three 1.5-hour meetings over the course of the next 3 months. Convene healthcare providers, convene parents to come together 3 times, faith community leaders. And when we get together, we have dynamic interactions and discussions like I've talked about here. Let's say you have 4 long-term care facilities in your community. You know it's related to the prescription drug abuse problem. Invite those long-term care facility representatives to come together for a series of 2 or 3 meetings to think about and discuss the prescription drug abuse problem and how we might work together to address it. So if it's too much for your regular meeting, it's okay to host a separate meeting, a think tank or a discussion, and define the parameters for involvement, and which will in turn increase the likelihood that people will participate. Bottom line, meetings should be a time of dynamic dialogue and interaction between the members to determine the actions of each member that need to be taken to achieve a common goal. We can't expect people to align their strategies if we're not talking about it in the meeting. We have to create the workspace. One of my favorite tools that I use, imagine that this is a piece of flip chart paper and that this flip chart paper is hanging on the wall. And you put it up on the wall. I like to do things in meetings with flip chart paper because it increases group ownership and group accountability. If everybody is staring at their belly button And that's what I say happens when we pass out a bunch of 8.5 by 11 pieces of paper. Everybody ends up staring at their belly button. There's no group accountability. So let's move out of working from papers in front of individuals to working with collective work on flip chart paper on the wall. So let's say that one of our agenda items, one of our goals is to increase the number of homes that are securing their medications. I would put up a piece of flip chart paper on the wall, and I would put on the top of that piece of flip chart paper, increase the number of medications of homes securing their medication. And then I would ask the group, if we are truly going to get homes to secure their medication, if we're going to get families to lock up their prescriptions, what are the actions as a community that we're going to have to take? So I would then close my mouth, and sometimes I would have to wrap it in gauze and bite my tongue because I can't do all the talking. I have to stand there and let the community talk. So let's say, for example, we ask the community, what do we got to do if we're going to get homes to secure their medication? And somebody in the group might raise their hand and say, well, we have to first understand why they don't lock their meds, right? We need some understanding about why. Then we might say, we need to pass out lock boxes. You can see I can't type very well. We got to pass out lock boxes. What else do we need to do? We need to partner with pharmacies to get the lock boxes in the community. All right, what else do we need to do? And then we would, and again, this is on a piece of flip chart paper in the front of the room. I got my markers, I'm getting my hands dirty. I'm letting the community tell me what are the actions that we need to take. Then we would go over here to the by who column, and when we say, we need to find out why people don't lock up their meds. Well, who's going to do that? Well, we might have somebody in the room from the local university that says, well, there's research that does that. So we have UC University who says, we'll bring some information by when to the next meeting, so in 30 days, then we can help the community understand why people don't lock their beds. All right, great. So what's the thing about distributing lock boxes? How are we going to distribute lock boxes? Well, one of the partners in the room, maybe some of you on the phone, have funding from the state that says, wait a minute, we have funding to be able to distribute the boxes. Okay, who has that funding? Well, XYZ agency has that funding. All right, well, if we come back together in the next meeting, can you tell us about that funding and what the resources are? Can you do that next month? Yes, absolutely. So we got to partner with the pharmacies. Okay, who has a connection to the pharmacies? Well, I don't have a connection to the pharmacies, but my neighbor is a pharmacist. My name is Mary, and I'll talk to my neighbor about how we could partner with the pharmacist. Okay, when are you going to be able to get that done? Well, I probably can do that before the next meeting. So now as a community, we have the UC University representative who chimed in. We have the XYZ agency who has chimed in. We have Mary who has chimed in. And we're able to collectively begin to think about what is it going to take to get families to secure their medication. One agency doing one program is not going to get all the homes in the county to secure their medication. It's not going to happen. Not one agency with one program. But if we have multiple agencies across multiple systems working together in a way that is aligned, we probably can increase significantly the number of homes that are securing their medication. Because as we go through this conversation, somebody else might say, well, we need to do a media awareness campaign, right? If we're going to truly get here, how are we going to do that? And so we would say, okay, well, who can head up a media awareness campaign? And then we have crickets in the room and nobody volunteers. That's okay. We'll leave it blank for now because I'm going to erase all of my animations that I've done here. I'm going to pretend like I got a new piece of flip chart paper. And instead of at the top saying increase the number of homes securing medications, at the top I would put one of the strategies that we just talked about, like Why is it not working? Hold on. Like, let's do a media awareness campaign. And then I would ask, all right, if we're going to do a media awareness campaign, what are the steps that we need to take? Well, first we need to understand what tools are available. What media campaigns have already been created? Where do people in our community access media? And we would have a whole other list of things that need to be done. And that's not one person's responsibility, because we would have multiple people around the table who are saying, wait a minute, I can do that piece, I can do that piece. I tell the story of my daughter being in first grade. And when she was in first grade, she had a Girl Scout leader who was phenomenal. She used to let the kids camp out in her backyard, and I would see her everywhere at the grocery store. She asked me if I would co-lead the troop. Mind you, in 2012, I slept in 22 states, so I can't co-lead a troop. I'm not available enough, and frankly, that's not my personality. So I felt really bad because I told her, no, I can't do that, and so I avoided her at the grocery store and at the gas station and at school and all of those things. I was on an airport transport bus in the state of Utah. I think it was Utah, it might have been Montana. And she called me and she said, Rhonda, I need you to take the number of boxes of cookies that we sold, to put them in an Excel spreadsheet and calculate the number of cases that we need to order so that I can place the order tomorrow and I don't have time tonight. Can you do that? And I did a little happy dance on the transport bus because I'm like, oh my God, yes, I can do that. That'll take me an hour. I can do that at my hotel tonight. So I calculated the number of cases and I sent it over, and she successfully ordered Girl Scout cookies for the troop. I was given the opportunity to have ownership in the troop without having to lead the troop. This kind of activity that we just went through gives you tools to allow partners and members of your group to have ownership in the whole without taking on the whole. If you said who can manage, who can be the chairperson of a media campaign, I doubt if anybody's going to volunteer for that. But when you begin to break it down into parts and pieces, that's where you'll see people begin to volunteer. That's where people will say, wait a minute, I can do that part. And you might have partners on your Match Your Connections chart where you have a dotted line because you're sitting in the same room but you don't really work together. It will be amazing how you will see those working relationships begin to emerge, because people oftentimes don't know how to work together. The university might come and sit at your coalition meeting or offer to be a partner. Faith communities oftentimes will offer to be a partner for years and years and years, but they don't know what to do. They don't know what they're supposed to be doing. They're not innovators. They're not strategic thinkers. They have congregations that they manage and they do it really well in their silo of excellence. But they don't know how to partner. When we start doing this kind of work, if we put at the top of this paper, distribute drug medication lockboxes, and we ask the room, what's it going to take to distribute medication lockboxes? That's where the faith community is going to jump in and say, yo, wait a minute. We have a connection to the senior community in our church. We can help distribute lockboxes. Versus me as an agency going out and saying, here, everybody, take the lockboxes. We have to find those connections. And using tools like this in a meeting allows us to really awaken the connections and the opportunities that our partners bring to the work. So, again, imagine this is a piece of flip chart paper and not on a computer screen, but it really is a pretty dynamic tool for engaging partners in the work. So the next series of slides, and again, you'll have an opportunity to read through those when you get those. This is about sending items to committees. How do you create a committee and a task force and a work group? How do you manage group dynamics? The whole idea of a learning organization. We actually have talked about that quite a bit. The idea of discussions, talking with a group versus talking to a group. And all of this about using data as a learning tool. You're welcome to read through those when you receive the PowerPoint and follow up with me for a technical assistance call. I want to focus on one more before we finish up today, and that is this strengthening the organization learning muscle, and this idea of real-time feedback loops. When we do something as a coalition, when we try something or we attempt something as a partnership, a collaborative, oftentimes we walk away without debriefing. In the military, they call it an AAR, an after action report, and asking what went well, what did not go well, what did we learn, what would we have done differently, what do we need to do next. If you have an opportunity, you're in a meeting, you have time on agenda, or you're a coalition leader, even after a meeting, sitting down with a couple of key people for 10 minutes. It's not something that has to take 3 hours. You don't have to wait to schedule a meeting, get everybody together in the same room, and it's 6 months later and you still haven't done your AAR. Just group together for 5 minutes or 10 minutes after the meeting, especially when you're trying on something new, like reorganizing your agenda or using flip charts to delegate tasks or aligning partners. Take 5 minutes and ask, okay, what about that meeting went well? Even if you're meeting one-on-one with a partner and you walk away, find somebody back in your office, or even do it on your own and say, what went well about that meeting with that partner? What didn't go well? What did we learn in that meeting? What could we have done differently? And then very important, which is not on this list, is what do we need to do next? Taking the time to debrief and understand what you learned helps us continue to grow and not stay stuck in a space. Coalitions and collective impact efforts oftentimes become very stuck. They don't move. They're very busy, but they're not effective. And sometimes that's because we're not taking the time to learn what we learned and use that learning to propel us in new and different ways. Instead, we just come back to the meeting and do the same thing we did last time. We go to a different partner and do the same thing we did with the last partner that told us no. We have to take the time to debrief, learn what we learned, and use that learning to do something new and different to advance our work as we move forward. So that takes us back to your mapping my connections and linking and aligning for action. If we think about that mapping my connections, with each of the partners that we have, we can ask, do we have a common agenda? Do we have a common goal? Have we talked about how our goals are the same or similar? Do we understand why working together is important? When we go out and meet and talk with a partner, we can start by saying, here's what I'm doing. Tell me about what you're doing. And then the question is, how can we work together so that you're better and I'm better? You're more effective and I'm more effective. So if we have a one-way line between our goal and the United Way, for example, in this one that we're looking at here, we can ask ourselves, how can we meet with them or talk with them to make that a two-way line? Maybe the conversation, we go in and we meet with them and say, tell me about what you're doing around prescription drug abuse. I want to learn more about who you are and what you're doing. Let me share with you what I'm doing. And then we can have a conversation about how we can do it together. Are we sharing our data? Are we engaged in mutually reinforcing activities? Do we have continuous communication? Do we have an established infrastructure for working together? A lot of times we expect the two-way arrow just to happen by magic, but the secret is it doesn't happen by magic. We have to do the hard work. We have to engage in conversations. We have to create the space for collective impact to occur. And at the same time, part of my hope coming out of this webinar is that you'll begin to think about not just the partners you currently have, but who are some of those outliers that you could potentially partner with that you haven't partnered with in the past. And once you think about who they are, then the conversation becomes, tell me about what you're doing, let me tell you about what I'm doing, and then let's talk about how we can work together. And if the answer is there's no space for us to work together, have an after-action report, think about what went right but didn't, and find a new partner. Go talk to somebody new and keep working at it. Because we have a lot of programs, a lot of services that have a lot of resources to do a lot of good things in the communities, but they're not quite as big or as effective as they could or should be And some of that is because they're operating in their silos. Even if that isn't a silo of excellence, operating in silos is not going to get us where we need to be. We got to come out of our silos and figure out ways to work better and more efficiently together. So my challenge in the last 1.5 minutes is to ask you, what did you learn? What are your questions? And where do you go from here? How do you take this material and infuse it into the work that you have going on already? And I'm going to take us all the way back to the first slide and remind you of my email address, and that's rhondaramseymolina@gmail.com. I'm happy to get on a call with you, and we have built-in technical assistance time so that you and I can get together on a call. We can talk, and I'm going to remind you of my face so you know who's talking, maybe, so that you and I can talk about the issues that you're facing in your community with your programs, your strategies, how you individually can elevate your work in your community, how you can better align your partners. And a lot of that is more productive when done one-on-one versus in a group or particularly on a webinar. So please don't forget my email address. Jamie, I'm going to propose as well that as we come out of this webinar, I get a list of the participants that participated, and I will follow up with individual emails to everybody and make sure that you have a second option or offer for a technical assistance time as you think about applying this information to your community. So with that, I'm going to call it a day. Again, kudos. I can't believe how many people stuck through a 3-hour webinar. That is really incredible and really impressive for the state of North Carolina. Thanks for the opportunity. Thanks for hanging in there, and I certainly hope that I hear from many of you. Jamie?
Yes, thank you, Rhonda. And we will be sending out certificates, CEUs, next week. And please remember to complete the webinar evaluation that will be included inside the email and linked to your computer's browser when you end your session. Just complete the survey one time. And thanks so much. Take care.
Thanks, Jamie, for that, Rhonda.